Acting Chair Giogo, would you like to kick this meeting off?
Yeah, good afternoon, everybody. Thanks for joining us today. Glad to see so many folks here today. So we're here for our MCOTA meeting, September 25th, and you see the agenda on the screen there. First thing, we'll call the meeting to order at 1:01, and we'll review and approve the meeting minutes from May, which I believe were sent out. So we'll go ahead. I think those will be put on the screen as well. I think Tom might walk through them very briefly and answer any questions folks might have.
I'll just do a little process. Let's do the roll call first so we can adopt the minutes with the quorum. So I'm gonna, in the chat, the members only, the people listed here, should indicate whether they're here and just say here in the chat. Chris, Giogo, and Brandon did a fine job saying they're here. Anyone else?
A few members just joined as well.
Excuse me?
A few members just joined as well, so you could request that one more time.
Yes, we're doing roll call right now, and we got the member list, membership list of the MCOTA. If you are one of those fine individuals, please tell us that you're here in the chat.
Shirley, I see you're here. We'll mark you down.
Thank you, Jerry. Thank you, Shirley. We need 7. We are at 5.
Peter just joined as well.
Say that again, please.
Peter just joined as well.
Hey, Peter, it's been a while. Glad you could join us. Thank you.
Hi, everybody.
Sarah Dondor will not be joining us. She's on her way to Chicago.
So Tom, in the interest of time, why don't we come back to the meeting minutes? We don't have enough for a quorum, so we technically can't vote on it. We can always
You are correct, sir.
To the next meeting. So if we could put the agenda for today's meeting up on the board again, please. Thank you. So you'll see the agenda there. It's also in your invitation if you want to take a look at it. I'll pause for a minute to see if anybody has any additional items they want to add today to the agenda or move around or anything like that. Otherwise, we'll go ahead and get started.
Our guest speaker, Kirsten, in the audience.
I am here.
Hey, Kirsten, thank you for joining us. Very much appreciate it.
Absolutely. And CJ, I may ask if you don't mind, if you can run the slide deck for me. I'm having a little bit of connection issue in terms of the Zoom meeting today, but.
Absolutely. I'll pull that up now.
Thank you.
I'm not seeing anything in chat, Giogo. So, Mr. Chair, I believe we don't have any comments about the agenda.
Yeah, perfect. Let's give CJ just a second here to get the screen up, and we'll welcome Kristen Olson to talk about the multi-sector blueprint for aging. So appreciate you being here today. Excited to hear your presentation, and take it away whenever you're ready.
Just a
Thank you.
Kristen, could you hang on for a second? Apologize. Somebody had their hand up. I think it was Shirley. Shirley, did you have your hand up? Okay. Well, welcome, Kirsten.
Nope, I
Appreciate
was
you
trying
being
to
coming.
unmute and don't.
Oh.
This is Shirley. Nope,
Oh,
I
hi,
don't think I
Shirley.
am, and I was trying to unmute. Sorry.
Okay, did you have a question?
I did not have a question. I will-
Okay, all right. Well, sorry about that, Joe. I kind of walked over you a little bit. I just wanted to make sure that we covered somebody had a question about the agenda, what we're going to be about. But here we go. Kirsten, welcome again.
Thanks very much. I really appreciate your invitation today. CJ, you can move on to the next slide. So my name is Kirsten Olson. I am the interim director for the Age Friendly Minnesota Council. And I guess I should say thank you for having me back, because I did come and give MCOTA just kind of a brief overview of the work of Age Friendly Minnesota a few months back. So today, what I'm here to talk about is we'll do a little recap of Age Friendly and the Age Friendly kind of policy goals, and then move into updated work on the multi-sector blueprint for aging. So Age Friendly Minnesota is really a new paradigm or way of thinking about aging. And you can move to the next slide, please. Our current systems were not created for modern aging. Age-friendly is the concept of strategically responding to the challenges of aging related to the built environment, social environment, service delivery access, and overall culture around aging. The Age-Friendly Minnesota Council is a structure that's built on that coordination and connection. Our goal is to use a multi-sector approach of bringing together government agencies, public and private agencies, nonprofits, and philanthropic organizations to help create a more diverse, inclusive, and supportive environment for all ages. Next slide, please. To reframe the conversation, the Council looks for ways to connect traditional aging partners and government agencies with non-traditional partners. We're working to build these relationships, share knowledge, and find commonality across many different sectors through open discussions about aging systems, community connections, elder justice issues, healthcare, and economic stability. And through the discussions that we're having with many of the non-traditional partners, including emergency responder networks, the civic organizations, chambers of commerce, Governor's Task Force on Broadband, the Arts Council, we're really trying to create momentum around the idea of centralizing aging concepts into the work of the sectors, creating programming and systems that will benefit current and future generations. Next slide, please. So the work to date, we talked a little bit about this at the last time I was before the council, but the work to date has included not only coordination and integration of aging across the state agencies and non-traditional partners, but also we're focused on the idea of reframing aging, which is really increasing public understanding of anti-ageist and inclusive language through these conversations. Our council was founded with the principles of equity, diversity, access, and inclusion at its core. And so we're taking steps through all of our work. The conferences or the convenings, policy development, our grants work, the multi-sector blueprint, to really ensure that the language that's used is spoken through lenses of respect and anti-discrimination. Our grants work is continuing, and I'll mention a little bit more about that at the end. But really, it's important to note that our first round of grants is completely concluded. So most of our community grant projects have ended. We have about 30 that are what we call expansion or extension grants. Those are happening across some parts of the state and will continue for the next year or so. But we're looking forward to a second round of grant opportunities going out to help build these community, age-friendly community aspects, and they will be falling within the ideas of the domains. So the multi-sector blueprint for aging domains. We also are continuing to move forward with our multi-sector blueprint for aging, which is the collaborative plan for Minnesotans that we hope will result in expanded economic opportunities, enhanced access to healthcare and preventative care or wellness programs, universal community design, increased access to flexible multimodal transportation options, enhanced intergenerational connections, and social dialogue through both human activities and broadband access. We also are really focused on ensuring that the blueprint itself, under our domain 2, fosters senses of community and mutual respect through increased awareness of self-determination, decisional supports, and again, the efforts to reframe aging. Next slide, please. And actually can jump right on to the next one. So the Minnesota Multi-Sector Blueprint for Aging, again, the idea is that this is a new type of collaborative plan. It helps to support and supplement the state plan on aging, and it's really strengthened through the work, the cross-collaboration and cross-collaborative or multi-sector work through all of the different departments that are part of the council, including Department of Health, Department of Transportation, DEED, the Veterans Affairs. All of these different pieces are really instrumental to ensuring that the work is done not just from the typical aging lens, but across all sectors. Next slide, please. This is an important slide because it really shows how we collected information that's necessary to create the blueprint itself. So we engaged in needs assessments of older adults. There were phone interviews that were done with specific languages. So we used English, Spanish, Somali, Hmong. There were a number of different in-person communications had with older adults throughout the state. We are continuing to have ongoing meetings with key partners. We had hundreds of surveys, comments, forms, ideas submitted to the Age Friendly Council with suggestions about tactics and things that Minnesotans feel are important to remember when having a discussion about aging, and also pieces of programs and priorities that the goal is to focus on when creating this and when implementing the blueprint. Next slide, please. So from all of that information, we distilled the topics to 4 domains that we're focused on within the blueprint. There are the domain 1 of connected communities with the highlights of affordable housing, multimodal transportation, public spaces for all ages and seasons, and digital engagement. Domain 2, emergency preparedness, individual rights and safety. That includes the areas of elder justice and emergency preparedness and response. Optimized health and longevity with the areas of integrated care, health, services and social supports, support for family, friend, and neighbor caregiving, age-friendly healthcare access, and a well-trained and well-compensated direct care workforce. And domain 4, economic security and vitality, financial security as we age, and community and economic contributors. So the blueprint itself is a series of domains with specific strategies, objectives, and tactics listed beneath. Next slide, please. So with that slide, you saw the outline of the domains and the strategies. Each of these strategies is broken out into separate objectives, and then within the objectives, there are separate tactics. Within the blueprint, the number of strategic areas varies. As you saw, some of the domains have 2 categories, 2 strategies, some have 4. So it really varied based on the engagement that we received from agencies, from the public, from anybody who had an interest in supplying information to the council regarding the blueprint. The idea is that the blueprint itself, when it's released, will be a document that is malleable. It will set out a plan for aging, and it will set out specific goals to be met within the next 2 years, 5 years, 10 years. But we understand that a 10-year plan is really only as good as the paper that it's written on. We need to see the action happen at the 2-year and the 5-year stage. And we also have to keep in mind all of the other outside forces as we move forward. So the goals that we have, we consider to be to some degree, the long-term goals are where we're headed. Those are our aspirational pieces. But the work that's being done that we're prioritizing are the pieces that are happening in the 2 to 5 years. So again, we're building the foundation for the next 10 years of work. We're building on current strengths so we can include implementation and augmentation of existing policies, as well as new pieces of legislation and things that we are hoping to move through in the next legislative session, next 2 legislative sessions. We're working to improve access and systems from the consumer's perspective, and including, as I mentioned, cross-sector representation and a balance of short, medium, and longer-term objectives. Now, to get into this a little bit more, let's go to the next slide. With the conversations that we've been having with many of our agency partners, one thing we've been discussing is, and I should say, again, not just agency partners, but agencies, philanthropic organizations, public sector, private sector, so many different entities. But we've been discussing the types of tactics and trying to identify what organizations are willing to and able to lead in these areas. Tactics themselves, again, can be across the spectrum. So they can be education and communication related. They can be policy or program related. The goals of these tactics, though, what we're really looking for as we start to formulate the framework for the tactics underneath each of the objectives, is pieces that address inequities and advance equity in aging. Items that are supported by data to justify prioritization and inform the metrics. Items that are feasible, both financially and politically. Items that are sustainable. Pieces that are potentially aligned with current administration and partner priorities. Because obviously, to find the leads in terms of moving these pieces forward, we need to make sure that the pieces are ready to go, and that there's a desire to create partner networks around those specific tactics. We're also looking for pieces that drive systems change. It could be a beginning of a systems change, a new priority, or something that is already in place. And things, if, again, in a perfect world, pieces that are supported by cross-sector partnerships. We believe that by having these conversations on the tactic level and around the, as we build up towards the strategy level, we can really get some good momentum by doing the cross-sector work and bringing together entities from Department of Natural Resources and transportation and deed, and just all of these conversations happening together can create a stronger partnership. Now, I want to show you an example of one of the tactics that we're talking about, and kind of how the domain will work. If you could go to the next slide, please, CJ. So as I mentioned before, we have 4 domains under the blueprint. Domain 4 is our economic security and vitality domain. Within that, one of those strategies is affording aging, and 2 of the objectives that have risen to the top based on all of the tactics and comments submitted by the public have been basic needs and beyond are met, and retirement preparedness. These are 2 concept ideas, 2 objectives, again, based on tactics submitted, that have fallen under the strategy 1, affording aging. So some of the tactics, and just this will become a little bit more clear in a moment, but again, with all of that input we received, if you remember a few slides back, from the community convenings, from the partner meetings, from the information that was submitted, we ended up with quite a few hundred separate tactics to be included within this framework, within our blueprint. And so specific examples of tactics that were proposed under this strategy include maintaining and ensuring effectiveness of the Prescription Drug Affordability Board, advocating for affordable hearing aid devices, increasing the income cap to access housing supports, educating people on the Minnesota Secure Choice Retirement Program for small businesses, and developing and promoting programs that provide incentives for saving, including ensuring that high school financial literacy programs are required for graduation and teach topics related to retirement and cost of care. So I just share those to give you an example of 5 different tactic ideas that were proposed by the community, that were proposed by agencies, that were proposed by entities that are interested in seeing this reformulated plan for an age-friendly Minnesota. The blueprint, again, its goal is to look at aging in a different way, to bring together all of these sectors and identify ways that we can reframe the problem, that we can reorganize around the idea of aging within each of these sectors. Moving on to the next slide, CJ. Domain 2 is another example. So under Domain 2, emergency preparedness, individual rights and safety, our first strategy, inclusive and integrated emergency preparedness and response, and 2 objectives that were defined through the tactics provided: supported community education, which really means it really refers to supporting education and training to increase older adult knowledge and preparedness related to a variety of emergencies, from extreme weather to health crises. And the integrated emergency response systems, which is really bringing together emergency preparedness and response systems to ensure that they're deliberately inclusive of older adults and better integrated for effective responses in all emergencies. So under these areas, a variety of tactics again were proposed. So they included things like working with DPS to move towards having a FEMA approved enhanced designation for the state of Minnesota, collaborating with senior centers and councils on aging to create a pool of mentors who could be on call with first responders when they have an emergency that involve older adults, or expanding the Livable Community Resource Library to include a toolbox, including universal forms for healthcare plans, medical information, accessibility needs, pet information, emergency contacts, and the like. So again, I'm just trying to show the breadth of responses that were received, the breadth of tactics, and the feasibility of some of these tactics as they fall under the specific objectives. Next slide, please. So what does all of this mean? Well, it means we have come to the next phase of the blueprint. So we have an outline of the blueprint. We know our domains, we know our strategies, we know our objectives, and we have lists upon lists of hundreds of tactics that fit nicely within each of these categories. So now what we're looking for is subject matter experts, agency leads, directors, heads, individuals who are interested in moving this work from a plan to implementation to come together and help us prioritize these tactics. So at this stage, we are going to be holding four conversations. All of them will be held in St. Paul, and they'll be on the dates of November. I'll just go through it in order: October 15th, October 28th, November 6th, and November 20th. Each one will focus on a specific domain, and our goal is to, again, to prioritize to bring people together in the room, sit them down at a table, look at the tactics, prioritize the tactics to identify actionable goals within the next 2 years, 5 years, 10 years. And then with these subject matter experts, once we have identified what can be moved forward, we will also identify priorities for implementation, appropriate agency organizations to help develop and implement the work. If they're not already identified, many of the tactics that were submitted with leads or specific organizations in mind. And then also to see if there's anything that's missing. Following so the work that comes out of the meetings will be refined and released to the public. And then immediately following the meetings, we also will engage the second step, which is to identify those in the room who are going to continue as parts of those work groups and move forward to set a schedule for meetings over the course of the next year to 2 years to 3 years, where we do quarterly check-ins to monitor progress and get new data on the work that's being done. Next slide, please. So I'm getting very close to out of time, so I'll just kind of jump through these. The slide deck can be shared with you afterwards, but basically this is just our timeline for the remainder of the year at least. We are going to be holding these action team convenings, refining them, refining the information that comes out and releasing that information. Next slide, please. Oh, next slide, please. Thank you. This is just a reminder. You can take a look at this information on your own and get it out in anytime you want to. This is a little more information about the grants piece. If there are community organizations that are interested, our community grants, we're hoping to get that round 2 out as soon as possible, hopefully within the next couple of weeks. And that should be it for the slide deck. Thank you.
Thank you, Kirsten, so much. That was a great presentation. I enjoyed hearing about some of the tactics. I was going to ask real briefly if you happen to know off the top of your head. If not, maybe we could hear about some in the future, if any of the tactics directly have transportation components to it, or at least once they're prioritized. I'm sure this group would love to hear which ones with transportation impacts were prioritized.
Yeah, absolutely. And I apologize for that. We, since our first 2 convenings are these 2, we've started to prioritize those, but our connected communities where transportation will come up is going to be in November. So, but I'd be happy to share that with the group.
Yeah, that'd be great. Other questions that folks have for Kirsten today? All right, not seeing any. Thank you again. And again, I'll just reiterate, I think we'd love to hear any tactics that are transportation related. Once you guys have that prioritization session, we'd love to hear a little bit more. All right, well, thank you, Kristen. Have a wonderful day. Appreciate you joining us today. You're obviously welcome to stay, but if your schedule requires you to go elsewhere, that's understandable. Let's see, we'll move to our next agenda item, which is the strategic work team update. So we'll go over to Tom for that part of the presentation today.
Surely I had the same problem. I can't find the mute button. Thank you very much. And Kirsten, thank you very much for joining us. That's really critical to the work and puts things into the context of different communities as we engage in this. As transportation access that we've been working on is associated with multiple agencies, as you can tell with the individuals that are here, but at the same time, we're working through those. So the strategic plan that was developed in 2020 and ran through 2024, literally by definition kind of ended on July 1st of 2024, this past over the summer. But prior to that, we started doing a strategic direction. And that strategic direction that we're moving on and creating the focus, a number of the individuals here in this the larger meeting of the MCOTA have been participating and working with us relative to moving that topic. And the topic that we focused on, and we didn't make up the topic, this is something that was identified by senior leadership the previous year, which indicated about 15 different areas. And it looks, when Kirsten was going through her category, it was a very similar process that we went through about 1.5 years, 2 years ago, actually, to kind of get the refocus of MCOTA associated with that. The problem with that was we had 15 areas that we were looking at, and we were trying to recently are trying to narrow it down, and we did. And I'm telling old news, but the old news and current news that we're working on is we're focusing on the providers' limitations and circumstances and barriers to maintain a active workforce, specifically driver workforce, to actually deliver the services that are really already been approved, positioned to actually be paid for with various different grant funding, specifically from MnDOT and others. To that end, the focus is trying to get the staffing levels up. There's a couple of different initiatives that we've already discussed in the work team. One of the initiatives was the one that the legislature directed MnDOT, our motor carrier friends, to work with DPS and others associated with the transportation relative to the barrier or perceived barriers or actual barriers of getting a CDL, commercial driver's license, as being a pretty significant issue. And that is what the department, meaning motor carrier part of MnDOT, is working with a stakeholder group that's pretty broad and across the board. Now, that includes trucking industry as well. So there's a lot of trucking interest, but there's transit also attached to that conversation. One of the things that I'm participating is in that group is to kind of keep the group mindful that it's more than just trucking, and the impact is across the board. And they're in their process of doing that. And I actually will be asking to the work team. We got another meeting coming up here in November for the larger MCOTA. We'll ask Laura Rhodes, who is our point person at the department, working on that study, to come join us on that conversation. That all said, it kind of gives you an idea of how we're moving ahead with our strategic plan and our strategic direction, that we're moving forward and moving this to getting some solid information, solid data to support whatever policies that this group actually comes to some conclusions. The intent is by the January meeting, at the very latest, the March meeting, but the January meeting, that we would actually have a pretty solid set of recommendation. Could go all the way up to legislation recommendation. Mostly we're hoping to focus on policy changes or adjustments that need to occur. But both are a possibility as we move through that process. So that's pretty much brings us up to date of where we're moving ourselves ahead in the strategic direction that we've been working on for the last 4 months, since July. So any questions about that and what's going on with that? We've got a fair amount of individuals from beyond MCOTA here today. Is there any question from that group that about what we're doing with the strategic direction work team update? Not checking chat. Somebody might have a question there. I don't see any. Okay. Well, one of the other things for strategic direction is also incorporating a transition from the previous strategic plan that we had in place that took us through 2024, and the transition to the direction that we're doing as a single topic, albeit very complex and many pieces and many moving parts to it, is to focus in on those, on that issue of the drivers. Well, staffing shortages, specific to driver shortages, that all aspects of our industry and our providers are suffering from, and in turn creating the issue of accessibility, access to transportation, which we've heard over and over and over again. And it also fits very well in the piece that Kirsten was just talking about just before in her presentation. That all said, the other piece is, as we're transitioning to this new strategic direction, the bottom line is we're looking at getting some real recommendations to that issue before our senior leadership at the next June meeting, which is June of 2025. We can be done with this earlier than that, depending on how some of the pieces are coming together. And when we get past the that conversation, there's going to be some work assignments that we're going to be doing, and I'm forewarning you on that. Any questions? Eric Day asked the question and Beverly's got a question. I'll start with Eric's. Eric, is clarification need? Will MCOTA focus only on driver recruitment and driver workforce? That is the major focus that we're looking at. And right now, it is not an only thing, it is a focus area that we're working. The previous work plan actually identified 15 areas where we can be paying attention to. Actually, driving staff and shortages was one of those 15. That by MCOTA decided at that time back in May, decided that we wanted to move forward with that topic, that area. So to give us, so we can put our resources to that. I see another message. And yeah, go ahead. Beverly, do your unmute.
Hi. So, okay, so my question's I'll add the context. So when I do presentations, I do present a lot as an RTCC, both on a state, national, and local level. And one of the pieces that I boast about, if not spend maybe a whole slide on, is the connection between the work we do regionally or locally is then communicated to state leaders, this group.
Yes.
I don't know if saying that moving forward feels genuine.
Well, that's a question that is still being dialogued about. Where do RTCCs and TCAPs fit into the world of, this is a MnDOT effort. RTCCs and TCAPs are a MnDOT effort and funded and supported by MnDOT. As resources get tighter and discussions need to move forward, there's a desire to kind of maybe refocus us in a direction that may be only slightly different than what we're doing right now, with the intention of maybe being more focused on 3 topics as opposed to 2 or 3 or 4 or 5 or 10. But that conversation is still pending at this time. There is going to be input brought forth from all the RTCCs and TCAPs in this. Relationship to MCOTA, any and all agencies, programs, stakeholder groups are very much an interest to MCOTA and how we would be looking at that. RTCCs and TCAPs were an easy resource in the very beginning days of we were doing the strategic plan. And part of the reason why the RTCCs and TCAPs were incorporated in the previous strategic plan, they were actually a key partner in what MCOTA was about. Now, it is not uniquely only RTCCs were partners, but essentially RTCCs and TCAPs were very key. And they were incorporated in the strategic plan, which I welcome any of the members or anyone here to go on the website. You can see the 2024 strategic plan, and you will see relative to the RTCs and TCAPs that are at this meeting today, we'll see that we have accomplished many of those pieces that was identified in that strategic plan to move forward. Did we do everything? No, because the bottom line is I don't know if we'll ever be able to do everything. But we keep plugging away at various different pieces, and as they come up, and also try to maintain a flexibility as we move forward, which actually fits exactly what RTCCs and TCAPs are doing on a day-to-day basis when they're dealing with the mobility management of their community and their various members of their communities, with always that constant piece saying, where's the transportation access? Where's the barriers to transportation access? And it goes across multiple programs. It's not just a DHS, non-emergency medical transportation. It's not just the waiver program. It's not aging programs. It's all of those different programs. It is all inclusive, which makes it very complex really quick. And part of the reason that the desire was, let's look at one area that we've identified as a big problem. And it is staffing, specifically retaining drivers Now, and it goes beyond the CDL, the conversation, because actually a good portion of the clientele are being transported, and relative to RTCs and TCAPs are really trying to fill in the gaps where public transit or other transportation providers don't do it. And most of that service is probably going to be rendered by a provider that doesn't even have CDL required vehicles. So the question comes down to, it goes beyond just, is the CDL, and that's essentially what MCOTA is focusing on, is more than just the conversation of CDL. Will be informed of what the motor carrier group does and their study and their requirement to report out the first of the year to the legislature. In turn, that gets incorporated into some of the findings that we move forward on. But we're also going to be soliciting a lot of providers that have never even thought of and nor are required to have a commercial driver's license. They may have to have a passenger endorsement. Vast majority of them do. They may have to have STS endorsement, and many of them are going to have the non-emergency medical transportation endorsement certificate relative to what DHS is doing, what MnDOT is doing with STS. So there's a cross-boundary conversation. Where this information gets fed from is actually with our partners, with RTCCs and TCAPs. They are not the only entity that would be feeding us that information, but they are certainly a critical part. Right now, we do not have full state coverage with RTCCs. MnDOT has put a hold on any expansion of RTCCs for the time being, until there is a full-fledged review of how we're doing this, how we're spending our resources. So I think I've answered your question, hopefully, Beverly.
Yes, so this would remain a space for, say, the issue. I know everything kind of does, maybe, as we said, filter up to driver shortage. But if the issue doesn't fit that topic, is this still a group we can bring those issues to?
Yes.
Okay,
Matter of fact, we'll depend on that.
all right, thank you.
And this is an invitation to all the other members. Right now, this is Beverly and a few others that are on the call today are from providers of the RTCCs and TCAP programs that we've got across the state in the metro area and greater Minnesota. These are funded by us. You've got programs as well in various different shapes and forms where transportation access is a component, and many of you already dug into that. Some of you are still kind of rethinking your think about how this all works and what's the relativity to your programming that you do. If anybody's willing to hear a 2-hour lecture from me, I will make it very clear every one of you are impacted by transportation, either the lack of, or the existence of, or the inadequacy of what is in existence of. And you understand the complexity associated with how to deliver those services in a reasonable and effective and cost-effective and effective to the ridership. And that's an end-user conversation that we're still going to be talking about. Any other questions? Did I cover? I think Eric put a few more. Eric, you want to unmute yourself?
Sure, Tom. This is Eric Day, Executive Director, Mid-Minnesota Development Commission. We are the agent that holds the Mid-Minnesota RTCC, and I think there's an unbelievable amount of work that we've accomplished, and I think there's an unbelievable amount of work that remains. And while driver recruitment has certainly been part of our work, and that has included helping to recruit not only volunteer drivers, but also professional drivers to work for our transit agencies and our NEMT providers. We're also looking at ways to recruit rideshare drivers to fill in some of the gaps, especially in the evenings and weekends in our rural area. There are other things that need to be done. This can't be just a one-sided coin, right? There are many potential riders that need to be educated. There are transportation providers that need technical assistance. There are human services type providers that need to know what the transportation resources are and what their limitations are. Just so many different things that need to occur in order for us to help reduce the transportation gaps in rural Minnesota. Transportation service is basically non-existent in the evenings and almost non-existent on the weekends in most of our communities in our 4-county area. People with transportation barriers don't turn into pumpkins after 5 o'clock on the weekday and all weekend long. They have lives. They need to be places. Transportation is a social determinant of health. If they can't get to your services are no good. If they can't get to their social engagements, to their worship opportunities, to their kids' or grandkids' school plays, doctor's appointments, whatever, they're going to have poor health, poor physical and mental health. They're going to be on the fast track to congregate living, and we're going to lose them from the fabric of our communities. So I definitely appreciate that professional driver recruitment is a primary focus, and I support that, but we can't lose sight of all these other pieces that are also important. Thank you.
Thank you, Eric. I appreciate that. The way the conversation was left back in May when we decided to focus on specifically the driver recruitment, professional drivers conversation. The other 14 items that we had identified at MCOTA are still there. They're still in queue. And I don't think any of those 14 are going to magically get cured in the next 12 months. Specifically without some level of attention from somebody. And hopefully it would be MCOTA. That said, I appreciate all your feedback and comments on that. We will take that to heart. There will be some work assignments to the MCOTA members, probably some engagement with the RTCCs and TCAPs on a few things, specifically your provider network that you've all been keeping up to date. And we're going to be utilizing that for something that we'll talk about in a minute here. And that is the survey. So I'm going to drop into that survey question.
Excuse me, Tom.
Yep.
We have quorum. So I'm wondering if you'd like to bring that up now with Vice Chair Reese or a little bit later.
Well, I think Giogo just heard you. We have quorum.
We have quorum. We have David Finley, Kelly Garvey, Chris Kakos, Brandon Nurmi, Giogo's here, Shirley's here, as well as Jerry. And I believe our new member, John Benson, is on. His name just says John. So if you could confirm your presence as well, that would be wonderful.
Hi, yes, this is John Benson. Thank you.
Perfect. Okay, that means there are 8 members present.
And I don't know if you listed off Peter Brickley, but I think he's here too. Does that make 9?
Peter was on shortly for a short period of time, but he's no longer present.
Okay, we're still at 8 though.
Yes.
Excellent. Giogo, we could move back up the agenda. If you
Sure. Yep. Let's go ahead and do the minutes quick.
Yep, we can do them quick.
Okay.
So we will let you read this because you're more than capable of reading it. This is the roll call that we had last time. Slide it through. We approved the minutes. We did that. We had a presentation for the Greater Minnesota Transit Plan. Now, put that in context with what Agewell and other entities, and right now Olmsted's going through a process of a planning process, as well as they're looking at how to measure the outcomes relative to the objectives of Olmsted. There's a whole different there's conversations going on. We spent a fair amount of time talking about the strategic direction and where we're moving on that. I pretty much already talked about most of that right now. And there was a discussion pretty in depth. Anybody being quoted here, I would appreciate you making sure you felt like you were quoted properly. We do the recordings with the intention of only making that for the meeting notes. So that was the end of that, mostly the conversation.
So in order to approve the minutes, we'll need a first from a member and a second from a second member, so we'll wait for one of those.
This is Brandon, I move.
Thank you, Brandon. Can we get a second?
Bentley seconds.
Thank you, David. Appreciate it. If in the chat, members only could vote yay or nay in approving the minutes, that would be great. All right, so we have 7 yeses and maybe a couple more coming in, so let's consider those approved. Thank you all. Maybe this would be a good time if John would be willing or interested to just introduce himself briefly to the group. As a new member to MCOTA, welcome. It's great to have you.
Hi, thank you. Yes, I am a new member, which means I know pretty much nothing about what you've been doing or what you're doing now. So I've been listening very closely, and there's a lot of new acronyms I'm not familiar with, which is always exciting. But I am here representing, I'm from State Services for the Blind. I'm Deputy Director of Program Services there. That's basically our vocational rehabilitation program, and I'm responsible for statewide oversight of that particular program, as well as a few others. I'm taking over from a person from Vocational Rehabilitation Services who had been serving and had then has separated from this group. And so I'm going to have to learn my role on a fast track, I think. I also need to, my thinking is that I'm also representing DEED as a department versus just my small part of the world. So with that assumption, I'm going to make some new friends, I'm sure. So happy to help, happy to be here. I've already got some thoughts based on what I've heard already. And yeah, looking forward to spending more time with this group.
Excellent. Thanks, John. Nice to meet you. Again, welcome and appreciate your you joining the group and look forward to working with you. I think we're on to the annual report then. Is that correct, Tom?
We are, and what I'd like to do before we get there, sorry, I didn't bring it up earlier, is that in the strategic plan and strategic direction specifically in the work that we're doing now is going to have some homework assignments being issued to the members for some additional information that we may need to have. Some of you have already provided it. You know who you are, so when you get the notice out from us on that, you can say, I already did that. I'm good to go. The rest of you have not had a chance to get to that request, then we'll move through that. It's associated with some of the information that we're trying to gather. The survey work, which we're going to pull up an example of that in a minute here. That said, you will have a chance to see that and take a look at it. It is very similar to what Brandon Mary had put together for a sample group. We expanded it probably a little bit. I think we went from 3 to 4 questions. We kept it simple. At the same time, we set it up in such a way that we can track the data a lot more effectively. What we need now is people who will fill it out. And we need contact information on who would be filling that information out and some input from you as the various different members and stakeholders that might be attached to this conversation today. Make sure that we're in that mix. So Kelly or CJ, would you just bring that up? I'm not going to walk through it.
Sure.
I just want to make sure people see what it looks like because it's going to be included in the meeting packet that comes out after this meeting.
Okay, and I apologize for jumping around a little bit. Do you need to approve the meeting agenda as well?
Thank you. Somebody remembers the rules. Yes, Diogo, do you want to run a little, adopt the agenda for today?
Sure. I mean, we're pretty much through it, but we certainly can. If we could get a motion to approve the agenda for September, and then we'll get a second.
Brandon, I motion.
Thank you, Brandon. Anybody else want to show up on the minutes today?
I
This is-
second. This is Kelly.
Thank you, Kelly. If we could have members of MCOTA vote in the chat, approval for the September meeting agenda. All right, there we go. We can document that in the minutes. All right, so I think we're now up to the annual report then.
Yes,
Yes.
I've pulled up the transportation provider survey.
So the survey right now, and I'm just gonna have CJ kind of walk through a little bit just from a structural point of view. The questions haven't really changed from what Brandon had put together for a sample group. We decided to expand it and then be more inclusive than just public transit. We want to include more public transit, but we want to be more inclusive to other agencies and programs and providers for that. And that comes down to the homework assignment that we're going to ask you to do. As each agency, you may identify some transportation providers that are working with you in your program. I'm going to answer Giogo's question. We're going to be pulling from the STS list. Not everybody that's an STS provider is automatically a non-emergency medical transportation, but everybody that's a non-emergency medical transportation provider is an STS provider. So utilizing that list should be able to get most of those non-emergency medical transportation providers. So we got each question does have a subpart asking like, what is the top 3 barriers? This is similar to what we shamelessly copied exactly what Brandon had done. We may have changed the verbiage just ever so slightly. But we want your feedback on this. That's your other homework assignment. Take a look at this and say, gee, where are you going with this? The next work team meeting is in October. We'll have that at the end of the meeting so you know. And at that meeting, we will be adopting, this is the survey that we're going to be sending out relative to providers. Any quick questions right now? I know we didn't walk through it all and didn't give you much chance to look at it. Many of the people here today are also been a part of the work team, so they would have already seen this.
For an answer to one of the questions in chat, we'll be forwarding this out to the TCAPs and the RTCCs so that they can also share with organizations in their areas. Correct?
Right. You are correct. I'm also utilizing the list of their provider inventory that they've done over the years and keep up to date. I'm using that same list as well. But they may have other providers they've come across since they updated their list. So. Thank you, Brandon. Any other quick comments from anybody right now? You'll have an opportunity to give us some feedback on this. So just want to make sure you see this. At the last work team meeting, we had a conversation, and actually in this larger MCOTA meeting, we've had a conversation about how are we measuring our success or challenges or barriers or perception of barriers from our end users, the people that actually utilize the service in its various different forms. Again, the question is, how do we get to the end users without going through the providers to some degree or another? That is a question that we'll be working on, but we have the questions to the end users, very much the same format, different kinds of questions. Getting a sense of what they are, who they're using, how frequently, for what purposes, and then getting into the conversation about the ride experience. How's it, has it been good? Has it been challenging? Whatever it happens to be, to get into it. Primarily, we're trying to say, how has this acted as a barrier to you to utilize whatever the issue is? Has this acted as a barrier to utilize your transportation access? That's the intent of this. That was the work group's intent of this thing, of this end user. They also saw this in a very earlier format. This is now going to be the more formal format that we're going to move out, yet subject to comments and feedback, and we'll declare victory at the October meeting. And you have a chance as MCOTA as a whole, even though you've not been attached to this conversation, to make comment as well. Any questions relative to this? Again, you will have a chance to look at this and make your comments in a more thoughtful way than a 30-second, I'll think about it.
When exploring shortages for operators across transportation, and then reaching out to the passengers to get their input on getting more operators in the transportation area. In that context, what is the value of determining driver behaviors as a determinant for blocking drivers from entering into this type of a service?
I think one of the challenges right now, and you can speak to it as well as I can, Brandon, and any other transportation operator that's on here. There's a few others, Tim Schmelzer and Mike Greenbaum and Scott. Various different providers are out there. The key element right now is the perception of a problem, and is sometimes 90% of the reality of the user. So we may be saying, I can't use this service. Well, maybe it's the question of you don't want to use the service because, and whatever the because is, they're unreliable. They never send a driver that actually speaks my language, whatever it happens to be. These are the type of things that we need to get a handle on as to why transportation access is a problem from the end user's point of view. How much of that is something directly related to how a provider will be hiring or not hiring, or have the opportunity to educate or to train their drivers appropriately associated with that, is also a learning curve on that. And that was something that was discussed to some degree by the work team. So, but still subject to question.
Okay, thank you.
Thank you, Jerry, for that bit of information. I think I need to talk to you offline about how we may be able to get that from you guys, from Metro providers. Any other questions relative to that? So those are two things as a heads up. You'll get those in the meeting notes, packet, and action plans or action items that we're asking you to follow up on and give us some feedback on. Annual report. Mr. Giogo, you want me to move on?
Yeah, sounds like we don't have any extra questions there. Let's move on.
Fantastic. I'm going to just kick this off by introducing Evan. Evan has been our main contact with our consulting firm that's been working with us and has done a good job of picking up where we left the annual report previously and some of the new adjustments that the communications work team has helped guide those conversations moving forward. I believe we got a few members here in the meeting. I know, Eric, you're a part of that. I think Shirley's a part of that, or not Shirley, Shelley is a part of that. So you are more than welcome to make comment or add color to any of the questions we got going on relative to this. This has been updated with some edits, none that, in my opinion, were significant. But please take the time. Again, we're not going to micro this in this meeting, but I just wanted Evan a chance to kind of walk you through the various different pieces. Also explain why there's blank pages in there. So Evan, please take it away.
Thank you, Tom. Good afternoon, everyone. This is the draft annual report. As Tom noted, if you guys do have any questions, feel free to jump in and let us know what your thoughts and comments are. So as CJ is scrolling through, I'll just give an overview. Really the main outline of the report hasn't changed. So if you do scroll through, you'll see a lot of the content has not changed too much, but what we have done is started to go through, kind of revise some of the wording of the text, add graphics here and there to make it jump out to the readers who are the legislators here of the state. So you can see as we have the executive summary, the mission, and the vision. We then get to the goals. We also cover the accomplishments of MCOTA over the last fiscal year, and then talk about our new strategic plan moving forward for the next fiscal year. Here's a timeline of the events over the last year. So again, July 2023 to July 2024. And then we start getting into the meat of the report here. So this is the introduction. We get into the actual structure and membership of MCOTA itself. So you have both text and a graphic. And then again, we'll go through and make sure all these are ADA accessible for readers. We also have our executive committee as well as our executive director. The legislative duties and the activities and accomplishments. So we were working with the communications work team to kind of spruce this up a bit. It hasn't been changed too much over the last few years, and so we thought it'd be good to, kind of rearrange some of this to make it a little bit more easier to read, easier to understand, and convey information much better.
I'm
So
also
this is a
going
little-
to
go ahead, Tom.
interject. This is where some of you might want to pay attention to some of the items, because some of the stuff that we're going to be talking about is going to be associated with your agency or your program. So if you're called out in the in our report, just take it some time to pay attention to what we're saying about you and make sure that we're saying it about you properly. So.
So here we go over the work teams from the last strategic plan. We also discuss mobility management as well as mobility managers. Again, mobility management, and then talking about some of the presentations for the last fiscal year. We also talk about the RTCCs as well as the TCAPs. And before, you should see a figure on the screen kind of outlining those different RTCCs as well as the TCAPs and the different areas, the contacts, and then the counties that each of those organizations serve. Here's a different visual. This is just a map showing each of those locations. Some recent articles from past newsletters. And then we have a group that was presenting at a recent conference. The new state legislation related to transportation access. If you guys have any that are not included, please let us know and we'll get those added in, and then we'll also link those to the actual legislation pages.
That's some of your homework that we'll be asking on those items where you've got a link to the legislation. It's been proven to be very helpful. And we were busy last session, so there's a lot there.
Some more information on some of the past activity over the last year. And then here talking about the new fiscal year strategic direction. We have our appendices, so if you have any questions on acronyms, this would be the spot to go to.
So John, you may want to go look at that section and you'll understand what every acronym means.
Makes sense to do that.
I'll be meeting with you separately too. So welcome aboard, John.
Here's Appendix B. So this is our membership list. And then again, the legislative duties and accomplishments, we're working with the communications work team to spruce this up a bit. Appendix D is progress to date on some of the issues, challenges, and opportunities identified by MCOTA back in 2021. Then Appendix E includes all the annual reports for both RTCCs as well as our TCAPs. So we do have a couple outstanding ones, but as we scroll through here, you'll get to see the annual overview of some of the activity each of our RTCs and TCAPs are doing.
Let me know if you'd like to stop through any of these as well.
Yeah, if there's any comments, questions, feel free to jump in and we can certainly go
One of
through
the
some
things
these.
I would like to have, if you can stop scrolling for a second.
Mhm.
One of the things I would like to food for thought for everybody, and it was a conversation ever so briefly at the last communication work team, was about each agency identifying projects that had transportation. So many of you have granting programs. DHS has a number of granting programs, specifically in the waiver area, where there's been transportation in the most recent grant cycle that you've gone through. And what we were thinking, even though MCOTA specifically did not have influence on it, in turn, it's an opportunity to say, here's how these different connections make their connection. These different items are about what each of the agencies are doing and how they're already affecting some impact currently as we speak. And I think it's good for us to take an acknowledgement of what is and what has been occurring to transportation access. When you do your respective annual reports, you're talking about everything your agency does. And transportation access might be a subcomponent of what you do in the program and how you report out on it. This is something where we wanted to concentrate the report out of various different activities happening across this, the enterprise, the state enterprise, relative to transportation access. And the vast majority of it is really good stuff. So toot your horn. So that's the opportunity.
Yeah, as you can see here, we're scrolling through. We have the different TCAPs and RTCCs. So we still have a couple that we're waiting on, but and then these are our TCAPs. So it goes Anoka starting first, Dakota County, New Tracks, which is Ramsey County, Scott and Carver County, Washington County, and then Hennepin just started, so they did not produce a report for this past year. And then our last appendix is funding sources. So with that, Tom, if you want to take over.
Yeah. Thank you. The question comes down to we can add a lot more to this. We've added a lot to this. We've also pared a lot from this. So to that end, we're tracking on keeping this to the body of the report is actually much shorter than the appendices. So we're trying to capture most of the attention of anybody reading this document. We get a pretty good sense in the actual body of the report itself of what, the who, the what, and the when, and the where, what has been accomplished, and what is still pending in that conversation. The appendices, if somebody wants to drill down a little bit further and say, well, what's happening in the metro area? Well, you've got, 5 of the 6 TCAPs in the metro area have reported out their annual report. That's their annual report to us, to MnDOT. And what I'm thinking in terms of, there's other agencies that have different programs relative to things that have been done with transportation access. So there might be another opportunity for us to share beyond what RTCCs and TCAPs have been doing. That said, we've done this for a number of years now relative to the strategic plan, where the RTCCs and TCAPs were very integral to the conversation of how MCOTA was moving various topics forward. And that's where RTCCs and TCAPs were an important partner in that conversation, but not the only partners that we're going to do. And that's one of the things we in the annual report haven't had a lot of opportunity created to talk about those other partnerships and other stakeholders that have been attached to this discussion. A lot of things happening with aging, as we just got reported out. A lot of things happening with health, with different areas that they're working on. There's, DEED, all of you. It's all the reason why you're sitting here. There's been different kinds of work that have been moved on in and on this last year. So take some time to actually think about that and what does that look like and how we're going to pull it in. It may not be something we can put into this annual report, but it is something that I think we would be looking toward the future. And so give it some thought. If you got something there, real quick statement of, oh, well, this legislation was passed or a new policy was created to do this relative to transportation access, please share it with us and we'll take it from there. Any questions?
All right, well, thank you, Evan and Tom. If folks have any additional questions or comments, feel free to put them in the chat for the remainder of the meeting, or I'm sure we could contact Tom as well if anything else.
Thank you.
With that, we'll move to our final piece of the agenda, which is public comment. So we'll open up the floor. We didn't receive any word of anybody in advance, I don't believe, but if somebody has joined us today and like to share any thoughts, we welcome those now. All right, well, not hearing any, just real quick then, we do have the future MCOTA meetings are listed on the screen there. They're on the agenda, which is in the invite as well. So Wednesday, November 20th is our next meeting. We'll look forward to seeing everybody there. And then Karen had a question in the chat if there's an annual report draft open to RTCCs to look at.
Probably based on some comments we may get back today, I think we can get a draft out to you guys to take a look at how your information specifically, we would definitely like your input of how your information has been shared. I'm pretty sure we took verbatim what you put in your narrative reports, but Evan may have taken some license and said interesting things. So please take a look at that part very specifically.
All right, one last call for any public comment that we might have today. Otherwise, we'll move to adjourn. All right, well, I want to thank everybody for joining us today. Appreciate it. Thank you for all the presenters and the feedback and discussion. Look forward to seeing everybody in November. And with that, we'll take a motion to adjourn our meeting today.
This is Brandon. I so move.
Thanks, Brandon. Can we get a second, please?
Jerry, second.
Thanks, Jerry. With that, we are adjourned 2:20. Have a great day, everybody. Enjoy the sun outside, and we'll see you guys in November.
Bye-bye.